Hi there, I'm Carol Bender, the nurse practitioner, the owner of Joy Wellness Partners and Enliven Aesthetics. Thank you for booking a PRP procedure for whether you're getting a vampire facial or PRP hair restoration or breast augmentation. These pre and post procedure instructions will be helpful for you as you prep for your procedure and know what to expect. So before the procedure, we recommend that you avoid using any anti-inflammatory medications, including Advil, Aleve, naproxen, aspirin, for about 3 to 7 days before the procedure. We also recommend that you stop using any topical retinoids for any vampire facials or any skin topical procedures, whether it's your neck that you're getting PRP microneedled into, or even the PRP with Aquagold. This would be an application where you'd want to avoid your topical retinoids. The hair restoration PRP procedure, you specifically want to wash your hair and scrub your scalp before the treatment that morning. You can use a dry brush to scrub the scalp and really clean it well. You want to avoid excess sun exposure to the area being treated for a week before the procedure. Additionally, let us know if you have any anxiety about the procedure, as we can provide you with an anti-anxiety injection if that's something that is really, a concern for you. You just bring a driver before the procedure or prepare to stay for about 3 hours after the procedure, and you can drive yourself home after that point in time. If you have any allergies to medications or latex, let us know in your pre-procedure paperwork and or a separate email. Make sure that you drink a lot of water, hydrate well, at least 3 to 4 days before the procedure. And smoking and alcohol is something you want to keep to a minimum for 3 days or more before the procedure. You want your platelets to be optimized, and smoking can inhibit the optimal level of platelets and the growth factors in your blood when we draw your blood for the PRP procedure. So if you have any history of cold sores, you want to let your provider know or let the staff know before you come in for the procedure. And this is related to specifically the vampire facial or the vampire facelift or any microneedling procedure, that you'll want to get an antiviral medication to treat before the facial, the day of the facial, and then the day after the facial. You'll be coming for your procedure, and you can take your medications that you're prescribed by your doctor, except anything like the Advil that we talked about, on the day of your procedure. That's really the only thing you have to know about on the day of your procedure, but you can let us know if any questions come up that day. On the aftercare instructions, you'll be getting an aftercare instruction sheet specific to your procedure, but make sure that you avoid the sun for 24 hours if you're getting a vampire facial, and that would be after the procedure. You can use sunscreen after that 24 hours, or just wear a hat and bring sunglasses. Initial bleeding should resolve within the first 24 hours. You can begin to start using some of the moisturizing serums that the nurses will provide you after you get home, but you won't want to wash your face for the 24 hours after the procedure. So be aware if you have any big events coming up. You don't want to be getting prepared for a big event the day of your vampire facial, because you won't be able to wear makeup until at least the day after when you're washing your face. Minor peeling and flakiness can occur after a few days for the hair restoration, the breast augmentation, and for the vampire facial. Don't pick at the skin. We don't want to cause any permanent scarring. Avoid gardening, cooking over a hot stove for long periods of time, sitting next to a fireplace or bonfire, hot baths or saunas for 2 weeks after the procedure. And when you're outside for the first 2 weeks after that 24 hours, you can use sunscreen with SPF 30 or higher. And even on cloudy days, you can still get a lot of sun exposure, so please use sunscreen judiciously. For the facials, you also, aside from the makeup, don't want to use any alpha hydroxy products for at least 5 days after the procedure. You can resume your home care regimen when skin is no longer peeling or flaking, and you can use the regenerative and hydrating products that you can be recommended by the nurses when you're getting your procedure. Some things like peptides, antioxidants, stem cell serums, vitamins A, C, and E can be really helpful for your face. And if you do want continuing skincare recommendations, we have the Skin RN, who can also provide you with extra guidance for the days or weeks following your facial procedure. Again, after the procedure, provide yourself with plenty of water and anything that you're trying to stimulate growth or regeneration, like the hair treatment, or if you're trying to grow more luscious skin or augment your breast size, you'll want to be definitely eating protein, organic legumes, hormone-free grass-fed meats, wild-caught fish, free-range chicken or turkey, as well as vegetables and fruit during your first month after the procedure to provide the injected PRP growth factors with the optimal nutrients for healing. Try our collagen powder or our glutamine powder if you want additional amino acid support for skin, hair, and tissue regeneration. A lot of our patients mention that they get the best results when they incorporate these into their life, into their diet after the procedure. You can again use Tylenol if you need for pain. Avoid the Advil and the NSAIDs. You'll be avoiding smoking and alcohol for as much as you can 3 days after the procedure, as they will also decrease the optimal results. Following the hair regrowth procedure, don't wash your hair or your scalp for 24 to 48 hours, but wait at least 2 weeks before coloring your hair again. If you really want to have the optimal results, more than one treatment may be necessary, and 2 to 3 treatments may be needed about 4 to 6 weeks apart. The standard of care across all the research studies when you're looking at hair restoration, breast augmentation, or vampire facial, the standard of care is 3 treatments in a year. So if you have any questions, please call our front desk for any 9 to 5 questions, 858-609-0866. You can always leave a message there after hours, or if you have any emergencies, you can always go to the emergency room. But please let us know if there is any fever, temperature greater than 101, bleeding, signs of infection, redness or drainage, and any excessive pain not relieved with medication. Thanks, and have a great procedure.